Today, we will be discussing genome mapping. We will discuss how genome mapping benefits patient lives and how the nurses are involved in the process. We will also be discussing how using genome maps in diagnostics compares to other techniques, as well as how it has revolutionized healthcare.
A genome map is a record of the entire genome of an organism. Human genome sequencing has the ability to universally change the way day-to-day healthcare is performed. It directly affects patients, healthcare providers, global leaders, and our economy, thus creating the power to provide unprecedented information of various nature and greater understanding of heritable determinants. It is being used to determine family, medical history, and to personalize medical treatments. Genome maps are being used increasingly in diagnostics.
45-year-old Jane Smith has been experiencing health issues for several months now. Her symptoms include heightened fatigue, lack of concentration, impulsive behavior, lack of interest in most activities, extreme irritability, mild hallucinations, and long periods of increased sadness. After several doctor's appointments, Jane's doctors diagnosed her with depression and prescribed her medication accordingly.
43-year-old Megan Clark has been having health issues for several months now. Her symptoms are similar to Jane's in that she is unusually tired, easily distracted, exhibits impulsive behaviors, delusional actions, and increased levels of sadness. Megan decided that it was time to see her doctor as well. However, unlike Jane Smith, a couple years back, Megan Clark had her genome sequenced.
After describing her symptoms to another doctor, they tested Jane for attention deficit disorder, bipolar disorder, and anemia. Further, the doctor narrowed Jane's symptoms down to ADHD and prescribed appropriate medication. After a few months of no improvement, Jane consulted with a psychiatrist and found, through more extensive testing, she was schizophrenic.
In Megan Clark's first appointment with her doctor, after hearing her symptoms and examining her genome, he diagnosed her with schizophrenia due to a very small mutation he found on an allele of a common gene that causes schizophrenia, and prescribed her medication accordingly. A few months later, Megan is feeling much better and learning how to cope with the disease she has inherited.
Genome mapping has drastically redefined the roles of nurses. Although the greatest impact of genome mapping has been on oncology and neuropsychiatric nurses, it has revolutionized the roles of all nurses at the bachelor and master's level. The American Association of Colleges of Nursing has amended its guidelines on the required skills and knowledge involving all areas of genetics that nurses must have. Also, most undergraduate programs have redrafted their curriculum to include genetics into their core education.